This is Junya Hatta from FuncPhysio Therapy. Today we're talking about cervicogenic headaches. This video, along with other ones that we produce, is based on a series from Work From Home. So if you haven't checked those videos out, please make sure you do. I'll put the links below as well. So what is cervicogenic headache? Cervicogenic headache is a type of headache that's considered secondary, which means that there are underlying problems that cause this issue. So one of those issues can actually be tightness or imbalances of muscles, or in the joints or in the nerves as well. So we want to talk to you about that today. Cervicogenic headache is considered as a secondary headache, and what that means is that other underlying problems are causing this issue. Some primary headaches include migraines as well as cluster headaches, and they're a little bit of a different category. What are the symptoms of cervicogenic headache? So with cervicogenic headache, we notice that there's a loss of range of motion in our neck. What that means is they're not able to turn their neck or bend their neck as much as they used to. Going along with that, they do notice that individuals with cervicogenic headache may actually trigger their headaches based on a certain neck position as well. Next, the type of pain that they may feel just around their eyes, or neck pain that's starting here, radiating all the way up to the side of the temple to cause a headache. Next, they also may notice that there's not only neck pain and a headache, but also pain down the arm as well. Lastly, with cervicogenic headache, there are some standard headache-like symptoms. So, for example, individuals with blurred vision, as well as sensitivity to light and noise, as well as some nausea as well. So some of those are very similar to other headaches, for example, such as migraines too. So what exactly causes cervicogenic headache? One of the things that we notice is that it's a secondary headache, so something might be the underlying problem, and the issues may be a tumor, it may be arthritis, it may be a whiplash injury, it may be a fracture that's happening in the upper cervical spine. Because of that, there might be some issues going up towards the head, which causes the headache. Individuals with cervicogenic headache, although we may not address, for example, a tumor or the fracture or something directly, can definitely benefit from physical therapy. One of the things that we notice in physical therapy, or we want to notice in physical therapy, is the proper alignment and movement of the cervical spine. By improving both, we'll be able to help you with the cervicogenic headache, reducing the amount of tension that may be on the muscles and joints in that area. One thing that we notice is that, unfortunately, because of the work from home situation, people may not have the best ergonomic setup. Once we don't have the best ergonomic setup, our posture is compromised. One of the trends that we notice is what's called an upper cross syndrome, where we're just going to have tightness in certain areas of the body and looseness or weakness in other areas as well. One pattern that we notice with our neck and chest is that when our shoulders come in, our lower cervical is going to flex or bend, and then our upper cervical, the head and chin, are going to come up. So you'll be in a certain position that makes you slouch forward and still trying to keep our head up. Once you look at that posture, what you're going to notice is that the muscles in the back of our head, especially the upper cervical, are going to be tight, and as well, the lower cervical is going to be weak. Lastly, because we are always in extension, or just trying to keep our head up, the facet joints, or the joints that are in the back of our neck, they're going to be compromised as well. They're not in proper alignment, and that may cause some irritation too. So taking those things into consideration, by having a proper alignment, as well as having good muscle balances, they're going to help you with your cervicogenic headache. So try these exercises out. Some of them stretches, some of them range of motion, some of them strengthening, but all these things will help improve the alignment as well as the function of each of the joints in your neck as well. So do these to help with your cervicogenic headache. Our next exercise, we made this little contraption. What it is that if you look inside here, it's a lacrosse ball. It's a lacrosse ball that's inside a sock. So hopefully you can use a clean sock. So what we're going to do is we're going to go ahead just onto our backs. And once again, we want to find the suboccipital location. So it'll be right here for me. That's where the base of the skull meets the neck. So if you can see right here. What we're going to do is we're going to go ahead, take a little contraption. We're just going to pull it just right underneath on the right and left side of our skull here. And you may have to use one of your hands just to hold it in place. And what you're going to do is you're going to go ahead, tuck your chin in, pressing your head into the ball there. I definitely feel it. Rocking back, tucking your chin in, and rocking back. Good. You're just going to do this several times, just massaging the area. So I definitely feel it. You could probably definitely feel it as well. And if you need to readjust, go ahead and readjust here. So. Good. Remember pressing your head into the ball as well as tucking your chin in. Well, I definitely feel it. But you definitely feel great after. For our next exercise, we're going to be doing the suboccipital stretch. For this, what you're going to need is you're just going to go ahead, take both hands, interlock our fingers. They're going to be placed right behind the head, where you want it in the suboccipital area, which is where the neck and head connect. Bring our elbows in, tuck our chin in, and not necessarily think about pulling it down, but think about pushing your head up into your hands. Now what that's going to do is that's going to create a natural swivel motion, sort of like a J motion, just in the suboccipital area instead of you just pulling down. So remember, instead of thinking about pulling down, think about pushing your head or neck up into the hands. You'll feel a stretch and hold. Good. If you do want to isolate for the right side versus the left side, so let's do the left suboccipital area. What you can do is you can go ahead, turn your head a little bit to the right, around 45 degrees. Hand's going to go to the opposite suboccipital area. Same thing as well. Don't think about just pulling down. Think about pushing your head up into the hands. So hands here, and then push my head up, tucking my chin in, and I'll feel the stretch. And good. And obviously you can switch to the other side as well. Remember, don't pull down, just hold the head and push the head up. For our next exercise, what you're going to need is you're going to need either a towel or this is a pillowcase, just fold it lengthwise. What you're going to do is you're just going to go ahead, put this so that the edge of the towel is at the base of the skull. As we previously mentioned, that's where the neck and skull or head meet, and that's where we want it. Next, let's say if we're going to practice rotating our head to the left, this is just going to come down and stay anchored here. Next, this towel is just going to be right underneath the earlobe. And what it's going to do is it's going to pull not only to the left, but also left and up as well, sort of in the direction of our eyes. So our eyes are a little bit higher than our ears, so trying to pull it up this way. And we're going to go ahead while having this anchored, pull straight. Good, looks like this from the side. As you notice, it's going to be pulled up and away. Hold this position and gently come back. And once again, if we're going to go in the opposite direction, remember now this side, the right side is being anchored. This is just going to be underneath the earlobe, a little bit higher up so it's the angle of our eyes. And then go ahead, we're pulling straight here. And gently come back. I would say the biggest mistake most of the patients do is they just try and pull straight. We want not only a little bit of rotation, but maybe a little bit of extension too. So remember, pull in the angle of our eyes, from the earlobe to our eyes. So in that angle. So in some physical therapist setting, they do recommend the chin tuck, which I agree is a great exercise, but we just want to up it up a little bit just to give you more of a stretch, more of an activation of those muscles. So as I previously mentioned, one of the things with our posture is that our shoulders come forward, lower cervical flexion, upper cervical extension. And what that does, it puts your compromised position so that even though your neck is down, you're trying to bring your head up. Now, we kind of want to do the opposite with our chin tuck, is trying to bring our chin in so it elongates the neck. One of the things that probably a lot of people do when they think of chin tuck is they try and jam their neck back. Well, our neck is supposed to be not in a compromised flex position, but extended and elongated. So I think that's what the imagery is instead of just jamming your head back. So enough talking, let's get started. So what you're going to do is you're just going to be in a seated comfortable position, and you're just going to take your thumb underneath your chin. What you're going to do is you're going to try and not only tuck your chin in, but try and swivel it up, sort of like a J shape. Okay, so think of not only just trying to draw your chin in, but also bringing your neck up and back as well. So your thumb's just going to be underneath, and you're going to try and excuse me, I can't talk about this, but trying to tuck your chin in with the thumb underneath you. You're just going to hold. Goal is around 10 seconds. Now, as you can see from the side right here, the chin is pushing down, thumb is pushing in, doing an isometric contraction. Isometric means that force is being produced without any motion. So as you can see, that's just going to be different. Instead of just jamming our chin back, trying to create a double chin, what we're trying to do is do neck flexion, upper cervical flexion instead of extension. So it's kind of like the opposite, as you can see. Once again, hold for 10 seconds. Some people doing this may actually feel a stretch just in the back of the neck. So that is resisted chin tucks. If you liked today's video, remember to like it, share it, also subscribe to our YouTube channel. And if you're on social media, please follow us on Facebook as well as Instagram for more great information. So this is Junya Hatta from FuncPhysio, and I'll see you on the next video.